Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 7th lecture on systemic pathology. Today, day 1 of colorectal diseases. Day 1 of colorectal diseases. Dear audience, today's topic is Hearthsprung disease. Before going to discuss about Hirschsprung disease, we want to recapitulate about the megacolon. Megacolon means marked dilatation of colon is known as megacolon. Marked dilatation of colon is known as megacolon. Dear audience, if this is the colon, and if this is the marked dilation of the colon, this marked dilation of colon is known as megacolon. Now come to types of megacolon. Megacolon may be congenital and acquired. Example of congenital megacolon is Hirschsprung disease. So example of congenital megacolon is Hearthsprung disease, acquired megacolon. Example of acquired megacolon in Chagas disease. Dear audience, first come to megacolon in Chagas disease. Before going to discuss about megacolon in Chagas disease, we want to recapitulate the structure of colon. Colon wall is composed of 3 layers: mucosa, submucosa, muscle coat, and serous coat. Colon wall is composed of 4 coats: mucosa, submucosa, muscle coat, and serous coat. If this is the mucosa, this is the submucosa, these are the muscle coat, and this is serous coat. And you know, within the wall of the colon there is two types of nerve plexus. One is Meissner's plexus, another is Orbach's plexus. So here there is nerve plexus, one is Meissner's plexus, another is Orbach's plexus. This Meissner's plexus and Orbach's plexus present in the wall of the colon is associated with normal peristalsis of the colon. These nerve plexuses are associated with peristalsis of colon. Dear audience, if there is destruction of these nerve plexuses, there will be functional loss of peristalsis of the colon. Again, there is mucosa, submucosa, muscle coat and serous coat, and within the wall there is nerve plexuses, Meissner's plexus and Orbach's plexus, and these plexuses are associated with peristalsis of the colon. If there is destruction of these plexuses, there will be functional loss of colonic peristalsis. What happens in Chagas disease? Dear audience, Chagas disease is caused by a fusiform hemoflagellate known as Trypanosoma cruzi. Chagas disease is caused by a fusiform hemoflagellate, that is Trypanosoma cruzi. This Trypanosoma cruzi destroys the Meissner's plexus and Orbach's plexus. The Trypanosoma cruzi destroys Meissner's plexus, destroys Orbach's plexus, as there is destruction of the Meissner's plexus and Orbach's plexus by Trypanosoma cruzi, there will be functional loss of peristalsis of the colon. Functional loss of peristalsis of colon. Here it is, suppose this is colon, and if there is loss of Meissner's plexus and Orbach's plexus here, in this part there will be functional loss of peristalsis. Functional loss of peristalsis in this segment. As there is functional loss of peristalsis in this segment, there will be colonic obstruction. There will be colonic obstruction. So in this segment there will be obstruction. As there is obstruction in this segment, the fecal matter will accumulate here and it will lead to dilatation here. It will lead to dilatation here. And this is marked dilatation of the colon due to functional loss of peristalsis, and this loss of peristalsis is due to destruction of Meissner's plexus and Orbus plexus by Trypanosoma cruzi hemoflagellate. Dilatation of colon proximal to obstruction due to accumulation of fecal material, and this is the megacolon in Chagas disease. Again, Chagas disease is caused by Trypanosoma cruzi, a fusiform hemoflagellate. It destroys the Meissner's plexus and Orbus plexus in the colonic oval. The part where there is destruction of this plexus, there will be functional loss of peristalsis. Due to functional loss of peristalsis, there will be obstruction of the colon, and above the obstruction there will be accumulation of fecal materials and there will be dilatation of the colon, and this is megacolon in Chagas disease. Dear audience, now come to Hearthsprung's disease. Hearthsprung disease is a congenital type of megacolon. Congenital megacolon. This Hirschsprung disease is common in Down syndrome. And this Hirschsprung disease is associated with genetic mutation usually. Now come to pathogenesis of Hirschsprung disease. Before going to discuss about the pathogenesis of Hearthsprung disease, we want to recapitulate about the development, about the embryogenesis. During development, neuroblast during development or during embryogenesis, neuroblast migrates in cephalocaudal direction in rectum. Neuroblast migrates in cephalocaudal direction in rectum. Dear audience, if this is the colon, and if this is the neuroblast, it migrates in cephalocaudal direction in the rectum, and this is the neuroblast. This is the neuroblast. Then the neuroblast develops Meissner's plexus and Orbeck's plexus. Derodanes again during embryogenesis or during development. How Meissner's plexus and Orbeck's plexus are formed in the walls of the colon. Neuroblast migrates in the cephalo direction in the rectum, and then there is development of Meissner's plexus and Orbeck's plexus. What happens in Hearthsprung disease? In Hirschsprung's disease, there is failure of migration of neuroblast in the colon. Failure of migration of neuroblast in colon. As there is failure of migration of neuroblast in the colon, the part where there is no neuroblast, there will be no ganglion cell. Due to failure of migration of neuroblast, there will be absence of ganglion cell in segment of colon. The segment of colon where there is no ganglion cell, in that segment there will be no development of Meissner's plexus and Orbeck's plexus. The segment of colon where there is no ganglion cell, there will be no development of Meissner's plexus and Orbeck's plexus. No development of Meissner's plexus and Orbeck's plexus. As there is no development of Meissner's plexus and Orbeck's plexus in the segment, in that segment there will be functional loss of peristalsis. Functional loss of peristalsis in the aganglionic segment. In the aganglionic segment of colon, and there will be obstruction in the aganglionic segment of colon due to functional loss of peristalsis. Obstruction of colon. Dear audience, about the segment of colon where there is obstruction, there will be accumulation of fecal material and there will be dilatation of the colon. That is, dilatation of colon due to accumulation of fecal material proximal to the obstruction. Dilatation of colon above the obstruction, that is proximal to obstruction, above the obstruction, and this is megacolon in Hearthsprung's disease. Dear audience, if this is the colon, and if this is the anorectal junction, so this is the colon and this is the anorectal junction. Usually there will be absence of ganglion cell in the anorectal junction in Hirschsprung disease. Usually lacking of ganglion cell found in anorectal junction. Usually lacking of ganglion cell found in anorectal junction. So at this site there will be absence of ganglion usually, and the upper margin of aganglionic segment of colon and the upper margin of aganglionic segment of colon is usually within rectum. Again, usually lacking of ganglion cell found in the anorectal junction, and usually the upper margin of aganglionic segment of colon is within the rectum. So the aganglionic segment in Hearthsprung disease usually within the rectum. Dear audience, again we recapitulate. Due to failure of migration of neuroblast, there will be lacking of ganglion cell in the segment of the colon, and it is usually the anorectal junction. And the aganglionic segment usually present in the rectum, that is the upper border of the aganglionic segment in Hirschsprung disease is usually within the rectum. And within the aganglionic segment there will be colonic obstruction, and proximal to it or above to it there will be dilatation of the colon due to accumulation of fecal material. Dear audience, now come to presentation of patient with Hearthsprung's disease. Dear audience, Hirschsprung disease usually found in neonate. It may be found in childhood and also in adult. It is usually found in neonate. May be found in childhood and in adult. The neonate presents with failure of passage of meconium. Failure of passage of meconium Besides this, there is obstructive constipation in neonate. Obstructive constipation of neonate. So these are the presentations of patient with Hearthsprung's disease. Dear audience, now come to histopathology of Hearthsprung's disease. Histopathology reveals absence of ganglion cell. Dear audience, as there is failure of migration of neuroblast, there will be absence of ganglion cells. There will be erratic proliferation of non-myelinated nerve fibers in non-dilated segment. Dear audience, I have told you there will be absence of ganglion cells due to failure of migration of neuroblast in the non-dilated part where there is development of colonic obstruction. And in that non-dilated part, we'll get absence of ganglion cells. In addition to it, there will be erratic proliferation of non-myelinated nerve fibers. This is the histopathology of Hearthsprung's disease. Dear audience, today I have told you Megacolon. Marked dilatation of colon is called Megacolon. There is congenital type of Megacolon as in Hirschsprung disease. Acquired type of Megacolon that is found in Chagas disease. The Trypanosoma cruzi, a fusiform hemoflagellate. It destroys the Meissner's plexus and the Auerbach's plexus. So there is functional loss of peristalsis, and this functional loss of peristalsis leads to colonic obstruction, and due to obstruction, above the obstruction or proximal to obstruction, there will be accumulation of fecal material and there will be marked dilation of the colon. What happens in Hearthsprung's disease? During development or during embryogenesis, there is failure of migration of the neuroblast in some segment of the colon. And due to failure of migration of the neuroblast, the segment where there is no ganglion cell, there will be no development of Meissner's plexus and Auerbach's plexus. So in that segment, there will be functional loss of peristalsis, there will be obstruction, and above the obstruction or proximal to the obstruction, there will be accumulation of fecal material and there will be marked dilatation. Usually, there is absence of ganglion cell in the anorectal junction, and usually the upper border of the aganglionic segment of colon is within the rectum. It is usually found in neonates, may be found in childhood, and in adult. Neonate presents with failure of passage of meconium and obstructive constipation. Histopathology reveals absence of ganglion cells and erratic proliferation of non-myelinated nerve fibers in the non-dilated segment. Dear audience, this is all about the Hearthsprung disease in a nutshell. Today up to this, thanks all.